So, frozen shoulder is a common problem that is faced by adults who complain of stiffness of the joint over the shoulder, and is usually associated with patients who complain of pain when they have to do overhead activities or stretch upwards or extend their shoulder. So the shoulder has four main ligaments, as you can see over here, and four main tendons. It's a combination of bone structures, tendons, and also muscles that make the stability of the joint that remains stable, and it has a good range of motion. So in adhesive capsulitis or frozen shoulder, the joint that is usually mobile becomes inflamed, red, and also it's associated with stiffness of the joint because it is contracted. So the joint remains contracted and there's limitation of movement of the shoulder or the arm. So what do we do in these conditions, or what works? Usually a good supervised physiotherapy sessions, close to 6 to 8 sessions that involves gentle manipulation and also movement of the joint, helps with overall outcomes. Second, the use of tablets, creams, plasters also helps. If needed, we do a small pain-free injection into the joint that we give a short duration or a small dose of steroids if patient is surgically fit. Also, besides that, we also, if this problem becomes a chronic problem and it is associated with stiffness of the joint that causes disruption of work or daily living, we usually give some anesthesia. That means we make you go to sleep for a little while, and we actually break the adhesions by gently moving the joint all around, and you usually get to move the joint the next day with great ease. Besides that, if this becomes a chronic problem of more than 6 to 3 months, then we probably need to do a small keyhole surgery which leaves scars close to less than 1 centimeter, about 2 of them. In summary, frozen shoulder has a multitude of treatment options. Treatment options that works is, first line would be physical and supervised physiotherapy that will involve gentle movement and manipulation of the joint. Second would be using moist heat if symptoms remain. The third option would be giving intra-articular injection into the joint, and this will give temporary and often allow physiotherapy and more range of motion. Now, if symptoms do not resolve, then a surgical option would include giving anesthesia and manipulating the joint and increasing improvement of range of motion. And lastly, if things worsen, we always can have the option of using a keyhole surgery to release the contractures.